Okay, thanks a lot. So the paper is about the elderly mobility, and in particular, I am focusing in this presentation on the distributional impacts and on the equity implication, which are related to infrastructural investments, which may affect the aging population. These are the results of a 3-year project that we have run in Italy and under the AGIT project and Italy Domani financial sources. And this is just a summary of these results because, as I said, it's a huge project which involves more than 1,000 researchers in Italy, and it is a part on the mobility aspects. So the idea is that we need to be aware of the aging population, and in particular, there are some areas, especially Europe, which is mostly affected by this shift, and in particular, Italy is at the top level in terms of burden of aging population on the total population structure. So we are going to face challenges that need to implement some changes in terms of the provision of public services. In particular, I am referring to the transport sector, and as we normally know in everywhere, more or less, infrastructure and mobility services then means that we use for providing public services are not adequate for the elderly. Normally, they are taught for those who are belonging to the working age cluster, or for those who are using cars for mobility, especially for systematic movements in our cities. But this has also some consequences under other aspects which are related to the health and the social aspects of this population cluster. Because if we reduce the mobility of this segment of population, then this has consequences in terms of health outcomes, and also this has also some effects in terms of isolation, and also it affects the quality of life of the elderly. So in terms of distribution, we may say that it is quite an even impact, and especially for those who belongs to low-income seniors, and also with those who have functional limitations, or they belong to those who are affected by some other advantages like economic disadvantages or social disadvantages. We need to consider some of the constraints that are affecting population, and in particular, it is not very easy to understand how we connect on these segments, because we may have different functional declines which may affect the mobility capability of people of moving in our cities, but also in rural areas or in peripheral areas, and so it's relevant transport use at budget. And with regard to this, we have run a huge sample exercise on 1,500 people in order to get the exact perception of their usage patterns, and in order to give some policy indication to policymakers. And we normally also fail by measuring the accessibility of people when we want to measure their mobility. And so we need to understand with a very clear framework which is the distance, and also which is the possibility that they may access in a better way in order to reflect their travel experience. So we recorded several barriers for the elderly, which are not only related to the physical effort, but also with the risks that these people perceive, and also they are related to non-cognitive elements like travel costs that they have to pay when there are no exceptional subsidies that are supporting this population cluster. And then there is also the equity consideration, which is related to the distributional effect of the investments in infrastructural transport endowments. In this case, we need to consider which are the real needs of this population cluster in order to provide services that can really bring an equity results in order to modify and so improving the quality of life of the elderly. So there are some research gaps that we can face, and also there are some approaches that we can use in order to guarantee better results in terms of financial allocation of resources on these investments. So there are a current gap in transport planning. It is not common that we know exactly who is getting benefits from an investment in these areas, and so we need to study and to have a different approach to these experts. We need also formal assessment framework in order to understand and also to measure the distributional impacts across the elderly population groups. And we need also to go over which is the efficiency metrics in order to evaluate the transport intervention. And also, instead of focusing only on accessibility, we need also to focus on mobility. So we can take into account also some other elements which may affect in a positive way the supply of transport services for the elderly people. There are different ways that we also can work on these, and there are different models. These are some of the examples that we were using during our research projects. There are welfare-based frameworks, gravity-based accessibility measure, expanded generalized cost components, and also equity-weighted analysis. In particular, with regard to this final one, this is one of the most common use for the economic evaluation and also for measuring the distributional effects of the provision of transport infrastructures. In this case, we can have different weights that can be allocated on different variables that we introduce in our model, and so we can see if we can get in the end some advantages or some disadvantages for the elderly in order to give a further a clearer idea of the progressive outcomes that are coming from the implementation of these models. These are some of the examples of the models that we were using. And we may say also summarizing some of the elements that can affect in a positive or a negative way the results. And so we are aware about the possibility of failing by measuring some of these elements. For example, I can mention the traditional cost models that we normally use for the evaluation of these elements, and they fail because they are not adequate for measuring, for example, the timing, or when we have to consider some of the critical factors that can have some effects on the seniors' mobility decision. So it is not the best proper model that we can use with regard to this. There are some other considerations which are related to the physical effort, so including walking distance there and standing time and some other elements which may affect the travel of these people, and these elements should be evaluated in our models. Otherwise, we are skipping some of the most important variables that are coming from the results of our sample. So we need to consider in our models, and there are some perceived risk components that are related, especially for local public transport, of failing, or if there is some perception of the presence of security on board or on the street. There are also some cognitive burden, of course, and some other sensitivity weights that we need to consider if there are some particular circumstances that are affecting the environment where these people are living. So these are, to say, a context elements or variables, macroeconomic variables, which may affect the evaluation of the implementation of these infrastructure endowments. So we need to have a different approach in evaluating these elements from accessibility welfare gains in order to evaluate the distributional effects that are coming from improving the availability of new infrastructure for the elderly. So we need to consider some progressive investment definition in order to take into consideration this population share. There are some other elements that we can consider in our framework. And one of these is, for example, the distributional weight cost and benefit analysis. So for those who are aware about the way that we are using this cost and benefit analysis, it is one way of considering it. And so we need to focus on some of the elements that can have final impacts on pedestrian improvements, public transport accessibility, demand responsible transport in terms of infrastructure and also transport means. And also we can use different cost reduction targets, which can help also the policymakers to make some change. So this has effects on the health benefits, on the social participation outcomes, target intervention design, and integration with health policies and inclusive technology design. So for future research, we can address to validate our models in terms of application of these elements, and we can use longitudinal mobility studies, technological accessibility evaluation, and also cross-sectorial impact assessment. These are the five, say, pathway that we are following during our development of our studies. So what we can take, bring it home. So we can say that equity must be explicitly considered. We need to targeted infrastructural investment just for the elderly. We need to address non-monetary barriers because there are some elements which are more important than the tariffs that the elderly are paying, and also technology can create a new device. In particular, digital solution may be not accessible for all the elderly, which are the final addresses of this implementation of infrastructures. So I would like to acknowledge the New Generation EU for providing financial resources for supporting our research, although the responsibility for all the elements presented here in our paper is only mine. Thank you very much indeed. I remain for any questions that you may have. Thanks a lot.